Good afternoon, ladies and gentlemen, and welcome to another episode of the Daily Friend Wrap. I'm your host, Nicholas Lorimer, today joined by Mr. Chris Hattingh. Let's get into the first news story of today. And this is the unfortunate news that President Ramaphosa has announced his intention to sign the National Health Insurance Bill tomorrow into law. He made this announcement yesterday and expected to go ahead tomorrow on Wednesday. This is a major threat to South Africa's healthcare system because it will essentially place far more of the decision-making powers over how money is spent in the South African healthcare system in the hands of government, taking it away from private citizens who have been fleeing the government sector due to its poor management of, among other things, funds for years now. And effectively, this will begin a process by which government will begin to direct the flows of money. Essentially, it will be something akin to an ESCOM of healthcare. In the statement put out by us at the Institute of Race Relations this morning, we talked. There are many negative aspects to this, but one of the negative aspects to this that will affect everyone from the rich to the poor is that this will likely cause the flight of many middle-class people, particularly people with high skills and good job opportunities overseas, who will then leave the country to get better healthcare, at which point they will not be paying the important share of South Africa's tax revenue that they already pay. There's about 1.9 million taxpayers who pay about 76% of all personal income tax and make up just over a quarter of all revenue that government will collect in the next year. If this group significantly reduces due to flight from NHI, it will have a major impact on the fiscus and basically make government's finances completely unsustainable. NHI will essentially prevent you from getting private medical cover or private medical insurance for things that are covered by NHI. It's a process that's going to be unrolled over probably several years at the very least. So it's not like tomorrow the entire healthcare system is changed, but this is the beginning of what will be a very negative process for South Africans' access to quality healthcare. And rather than upping the quality of healthcare for the poor, it is very likely to simply decrease the quality of healthcare for the middle class and the lower middle class. Chris, am I correct in my assessment there? What do you make of this? There's a lot to talk about here, but safe to say that the battle to fight NHI continues on to the next stage. It's likely going to be challenged in court.
Yeah, so three, I think, areas to highlight here. You mentioned the pressures on the tax base. There really hasn't been much provision for the NHI in and of itself in various iterations of the budget, the medium-term budget policy statement. But to fund this sort of thing, you need to increase VAT, personal income tax, other taxes. So those might then be implemented more progressively, but they are firmly on the table, I think. But so three things to highlight just from my point of view: the pressures and the added incentives on healthcare professionals to look for work outside of South Africa, the increased uncertainty that this introduces for them, their career paths. I'm not saying overnight this will result in a massive flight of that sort of human capacity, skills, and experience, but you add yet another reason to look for work elsewhere because you're not sure how it's going to be implemented. Even if you're the biggest proponent of the NHI, best case scenario, it increases uncertainty and anxiety around how it's going to be implemented. What is the role, not just for private medical schemes and insurance, but for medical professionals, your doctors, your nurses, your specialists, who spend years to earn their qualifications, have to do practical work, all that kind of thing. So that's one consideration, one area. Secondly, the sort of signal that this sends around policy formation, policy processes, what the current government thinks of the public participation process. You had various iterations of the bill, white papers, green papers, rounds of submissions written and oral, including many submissions made by the Institute of Race Relations, and seemingly all of which ignored across the board, from medical members associations, medical professionals associations, civil society like the Institute, and others, where the NHI bill in its form that it's going to be signed into law pretty much ignores those serious concerns around administrative responsibilities, powers for the minister, funding issues, impact on private medical care, your freedom to trade and to choose where you spend your money, all those sorts of things. And then thirdly, just to flag here once again the risk for big business and co-opting of big business by government. So you've had various processes, various platforms, things like NEDLAC and others, where business gets together with government and labor, and they say it's collaborative, and government is willing to reform and be pragmatic and not go with their worst excesses. Not in this particular case. Sort of using the sanction of your bigger businesses, your influential businesses, to push through something like this. And at the end of the day, it will end up hurting those bigger businesses arguably the most. Just today, according to some reports, Discovery's share price down 7.4%. And Discovery has tried to, I think, shift around on what it thinks of the NHI. Yes, it supports universal healthcare, but not in this form. But maybe we can work with government, maybe not. Be very careful as people in business what one engages with the government on, what platforms you engage on, what do you demand in terms of concessions, where do you walk away, where do you draw the line. That it's not just a case of government always setting the agenda and them getting to decide, yes, we're going to use this or not. And just a final takeaway. Yes, it will be rolled out over time, but something to flag for the future. The government will be able to say, yes, this is taking time because the private sector is holding back. They're not giving us the funding. They're fighting us in court. An opportunity again for government to demonize the private sector. So be ready for those arguments to appear.
Indeed. And of course, it's not just us who's criticized this law. I know the DA has already attacked it, saying that it is going to challenge this in court. And the South African Health Professionals Collaboration has also issued a statement. They say 25,000 healthcare professionals express profound disappointment in unworkable NHI bill destined to be signed into law. They say that they are preparing a legal challenge. A spokesperson for this group said, as healthcare practitioners, our primary concern is the well-being of our patients. As experts in our field, we believe the president has an obligation to ensure that NHI improves rather than limits overall healthcare for every citizen. He has failed to do this. So this is unfortunately, I think, a very bad piece of legislation, a piece of legislation that is going to make the life of millions of people worse and do very little to improve the lives of the very poor. So you can be sure that groups like us will continue our criticism of this. We will be pointing out where it is going wrong, and we'll be pushing government to repeal and reform as soon as possible, so that we can hopefully retain some of our healthcare professionals and high net worth individuals before they climb greener grass and other climes. Adding to the bad news of today, we've also gotten our latest quarterly employment figures, which show that quarter to quarter unemployment has risen on the official definition up to 32.9%. And under the expanded definition has increased by 0.8 percentage points to 41.9%. So I think the expanded definition is the better definition because that includes people who have given up looking for work. And that's now sitting at 42% of the country's inhabitants. Now, over the last while, we've seen the unemployment rate sort of bounce around. It sometimes goes a little bit down in a quarter, it sometimes goes a little bit up. The sort of normal things you might expect from the seasonal stuff. But overall, the country's employment system remains one of the worst in the world, with almost half of people who are looking for work out of work, which is a human tragedy on a sort of unmatched scale in many ways. That is millions of lives without proper ability to support themselves. That is millions of people who will not be able to ensure a better life for their children. That is millions of people who are searching for meaning and struggling with the feelings of not really, necessarily having kind of a job to give them sort of purpose, direction, anchoring in their lives. Chris, this is exactly the result of a multitude of bad policies. NHI, the sort of things that brought us NHI. Can you talk a little bit about, why our unemployment rate just sticks so high?
Yeah, and I think two big things to highlight: South Africa's labor legislation, the difficulty in terms of hiring, but also then in terms of firing. So you increase the pain threshold for businesses to employ people who might not be adequately skilled or educated because of the failings in the public education system, but you don't give them an opening into the labor market so that they could take on technical certificates. They could just take on part-time work to build up their experience and skills base, and over time then possibly enter more formal, secure, higher paying employment. So that labor market rigidity, it has been highlighted by numerous international analysts, commentators over the years as a big impediment to job creation in South Africa. And then secondly, the national minimum wage. And when you artificially increase the price of labor above what the market would ordinarily pay for it, then you're going to effectively price people out of employment. It's with any supply and demand, any good in the market, if it's artificially inflated, we get that with administered prices. For example, the government administers in electricity, water tariffs, all that kind of stuff. You then price out how many people can afford those particular goods. Now, that's not to say that you can't have protections around labor exploitation, around certain sort of not ceilings, but entry points around minimum wages, but it needs to be much more closely calibrated to what might be acceptable to the market. If it's so grossly overinflated, then I think for the majority of people, you just make it all the more difficult for them to be employed, because you make the price of their labor just artificially what it isn't and what it would be reflected in the normal sort of free market, as it were. So those two areas, I think, of special concern. And the uptick in the unemployment rate in and of itself maybe not the biggest thing in the world, but the fact that we always remain around this sort of average level above, especially 30%, I think in the context of a growing population, points to wider macroeconomic policies that are not geared in the right direction, where you discourage investment, job creation. Yes, you've got promises from the president, you've got talk about capital flowing into the country. If your gross fixed capital formation levels don't increase, if you don't have that labor market flexibility, then you just don't incentivize people taking on more employees and you price them out of work.
So surveys done by the Institute of Race Relations and many other groups across the country have found that unemployment remains, for most South Africans, the most pressing issue, with usually more than a third of respondents out of a long list saying that this is indeed the most pressing issue in their lives. So it's, I think, pretty bad news for the governing party that there has been no change, in fact, a slight worsening in the unemployment rate. And adding to this, we've just gotten news on a story over the weekend that Thabo Mbeki is not going to be campaigning for the ANC. So Thabo Mbeki was brought out in this election campaign. He had been campaigning for the ANC for the first time in a while. This is after being very critical of the party. He seems to have found his desire to campaign for it again, although it also appears to have been a little bit short-lived. So Thabo Mbeki has said that he's no longer going to be campaigning for the ANC, saying that he's got commitments dealing with diplomatic commitments to do with the conflicts in Sudan and the DRC, both of which are experiencing internal conflicts at the moment, civil wars. But according to media reporting, the real reason that Mbeki is suspending his campaign for the ANC has got not that much to do with diplomatic concerns, and rather concerns about how the ANC was using him in the campaign and who they were putting him on stage with. According to someone who spoke to the media, he said, quote, "The program left him feeling exploited, and he also felt some corrupt ANC leaders had tried to hijack his efforts." Earlier on Monday, those close to Mbeki suggested he was apprehensive that the same, which is what he believed this is what happened to him in KZN. He believed the same thing would happen to him in the Eastern Cape, where he was scheduled to go campaigning. And he became unavailable after his office raised questions about who approved his program in the Eastern Cape and who he would be on stage with and who he would have to engage with in the Eastern Cape. And when his office wasn't given those details, he pulled out. So, I mean, the fact that he has been at least a little bit campaigning for the ANC has probably helped the ANC, I'm sure. But I'm sure they're a little bit annoyed that so close to the election, he's going to suddenly stop. What do you make of this, Chris?
Yeah, the ANC's much vaunted elections machinery has kicked into higher gear over the past 2 weeks. You've seen an relative increase in its support in polling, especially from the Social Research Foundation. So the party is famed for getting its people out there, its representatives in the month before an election, and it seemed to be the case. But again, here we see those cracks emerging. So this isn't to say that it's going to result in a loss of 10 percentage points, but it is over time chipping away at just the perception of the ANC as still a well-run organization with coordination, with coherence, with agreement. And I must add that the former president feels exploited. I mean, yeah, I guess join the club for millions of South Africans and how they've been treated by the ANC over the years. So maybe a bit of Schadenfreude in that regard. That doesn't really particularly help, but it's something to think about.
Yeah, Thabo Mbeki has often been accused of being out of touch with South Africans. I think when he said that he was feeling exploited by the ANC, he had perhaps for the first time truly understood the sentiment of many South Africans. Just to highlight that point about the ANC's sort of late stage squeeze and boost in the polls, when the Social Research Foundation started their daily tracking poll on the 15th of April, the ANC was at 36% on a 60% turnout model. They have now gone all the way up to 44%, which is, I think, relatively expected. So if this polling is correct, and we still don't know if the polling is going to be correct, the ANC looks like it might end the election somewhere around 45-ish%. Although these last 2 weeks are going to be really critical, as is turnout. Is the ANC going to be able to turn out its voters? Is the opposition going to be able to turn out theirs? There's a lot to play for in this election. Okay, that is all the time we have for today. We hope you found this show interesting. That's a wrap. The Daily Friend Show and The Daily Friend are a project of the Institute of Race Relations, the IRR. The IRR is a think tank which was founded in 1929 to study race relations in South Africa and works to change government policy to improve race relations through non-racialism and to ensure the prosperity of all South Africans. If you like our work and would like to support us, please go to irr.org.za and click Support the IRR. Or you can go to thedailyfriend.co.za and click the